Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Did Not Learn in Med School. Today, I want to do a brief video on something interesting that happened to me just this week. I was trying to get an MRI approval for a younger individual for his low back pain with some radicular symptoms going into his lower extremities. Now, he's been dealing with this for several years now. He's tried chiropractic care, he's tried different types of massage, acupuncture, dry needling, and he's more recently gone through about 6 to 8 weeks of physical therapy and a pretty dedicated regimen. He came to see me about a month ago. He had just started physical therapy, but he was looking for more explanations of what's possibly going on. Now, he has particularly standard symptoms of radicular pain going down the leg, and the L4-5 distribution, mild weakness, some tingling, straight leg raise positive. And we know that the insurance companies like to play this game. And before we get there, we know that unnecessary imaging, x-rays, MRIs, CT scans, can sometimes do more harm than good, especially when we know that some of the images don't necessarily correlate with patient symptoms. And there's lots of studies about that, of how degenerative disc disease, we'll call it degenerative disc disease, shows up in MRIs, but the patients are asymptomatic. And we also, in the other end of the spectrum, sometimes we'll see patients that have pathology in some areas of their spine without those symptoms, but they show up with pathology in other places in their spine. And that takes a little bit of the physical exam and the knowledge about the human anatomy to appropriately diagnose somebody. Well, this one seems like a pretty straightforward case, and nothing's ever straightforward in medicine, but as straightforward as it can get. And we know insurances like to play this game of, hey, we need to go through the hoops of X, Y, and Z to have insurance approve an MRI. And some of those hoops will be, getting an X-ray, making sure that there's no X-ray reasons for the patient's symptoms. Now, I don't know why we do this. I think it's a little bit of a grab. If there's something that I believe is some instability or maybe some fractures, then I see the whole reason to get an MRI or an X-ray first. But more often than not, it's just to check the check mark for the insurance company. The other one is to make sure that the patient has gone through 4 to 6, sometimes 8 weeks of conservative treatment. That can look something like physical therapy, chiropractic therapy, or home exercise program that's led by a physician or one of these therapists. And that's quite frequently where we start with a lot of our patients. We'll send them to a good physical therapist or good chiropractor, or we'll work with them on a home exercise program, print something off, and make sure they come back and make sure that they're doing the exercise appropriately. More often than not, I'm going to refer to a physical therapist because I truly believe in it. And somewhere around 50 to 70% of my patients will get relief from their physical therapy alone, and they don't need any procedures. And if we can get things done without doing injections, great. Well, one of the other stipulations on most of the insurance companies is failure of medication management. And now usually they want two drugs from separate classes of medications. So that can look like something like non-steroidal anti-inflammatory medications, muscle relaxers, skeletal muscle relaxers, gabapentin, though it's not a great pain drug. It can look like Tylenol, steroids, oral steroids, and opioids, or something like tramadol. So these are some of the classes, and they want to see that you've tried and failed at least 2 of these. And then they also want to see the justification of topical uses of Biofreeze and Bengay and those kind of things. Those can sometimes fall in the category. Now, typically, patients will have tried several of these, but we know that most medications come with some sort of side effect, and there's no biological free lunch, as we like to say. So this young individual is pretty naturalistic. He's like, man, I don't really want to take any of those prescription drugs. They all have their side effects. I'm happy to take some supplements to might be recommended. And there's not really great supplements for radicular pain or pain that he was kind of describing. And, he's tried his occasional Tylenols and ibuprofens and nonsteroidal anti-inflammatories. Wasn't a really big fan of starting anything else. And I said, listen, I'm the same way. If I was in this much pain, unless it has to be pretty bad, 10 out of 10 severe pain, or I'm not being able to function before I can consider even taking some of these medications. And we had a good conversation about the long-term side effects of taking something like long-term non-steroidal anti-inflammatory medication and what detriment it does, not only for your GI tract, increases your risk of gastritis and ulcers, but it can also cause chronic kidney disease and cause other protein issues because of the kidney disease. It can cause immunological issues secondary to kidney disease. It can also cause increased risk of heart failure, increased risk of cardiovascular diseases, especially heart attacks and strokes. It can increase your risk of AFib. It can cause platelet disorder. So all these are not small reasons to these pretty significant reasons to avoid taking chronic non-steroidal anti-inflammatories, and even the small enough risk for someone that's maybe not 10 out of 10 pain, but maybe 7 out of 10 or 8 out of 10 pain. Well, nonetheless, this insurance company had decided to come back and deny the MRI because the patient chose not to take any of these medications. And obviously now we're between a rock and a hard spot. The patient is respecting his body, trying to do the things the right way, naturally, not be reliant on medications, not even look at medications as the first line of option. He wants to heal himself. But the insurance company's coming around saying, well, you didn't do what we want you to do, so we're going to deny your MRI. And that's very frustrating because what else do they expect us to do? And I don't know. Maybe this patient's going to want to have a epidural steroid injection if that's indicated for him, or maybe he'll choose one of my regenerative medicine therapies, platelet-rich plasma, platelet lysate. But that's not for me to decide right now because I want to see what's going on. I want to make sure that we know exactly what's going on the X-ray and MRI. What if he has a very large herniation that's being underplayed, and I go in there with the needle and I hit the discs or I hit a nerve? That's really the big reason why we get MRIs, at least in my practice, is because I want to view the MRI so I can plan the epidural safely and effectively if we go down that route. But the insurance company is now putting a barrier in front of that, putting a barrier in front of this person to get the pain relief that he's been in pain for 8+ weeks overall. And I think it's a shame. I really do. And part of the problem is you might have heard about these pharmacy benefit managers. Well, essentially, they are the ones that control the drug prices, and they're the ones that prescribe the medications to the patients. So essentially, say in my insurance, for example, I have to go through Express Scripts. And when I go through Express Scripts, I go to my physician and I say, they will ask me what pharmacy you use, Express Scripts. Okay, great. So we'll send the medication to them. Well, then Express Scripts will charge me my copay for that medication, whatever it might be. And they also get the benefit from the benefits from the insurance company to pay to fulfill the rest of that prescription, whatever my copay and my out-of-pocket pay doesn't fulfill. Now, what's also funny is that these pharmacies will make back-end deals with the insurance company to make the drugs as cheap as possible for them, for the insurance company, but as profitable as possible for the pharmacy. Well, the interesting thing is this is kind of what a PBM is, a pharmacy benefits manager. It's a company that oversees this and makes sure that it's operating at the most efficient way. Well, here's the kicker. The insurance company owns the pharmacy benefit manager. So they're all in cahoots with one another. And they call this vertical integration. Now, I'm not doing it as good enough justice to explain the full picture of how this actually works, but it's one of those things. Proof is in the pudding. Follow the money. You say what we want to say. The insurance company is dictating care once again without doctor's consent, without even the patient's consent at this time. It says you need to do this, you need to be prescribed medications before we'll even pay for an MRI that may or may not show something. But also, we will not approve a procedure until you get that MRI. It's it's just a small thing to increase the profits, increase the profits. And it's no wonder that American healthcare is in such turmoil, and patients and people and individuals and citizens are having more and more distrust in the system. This system was designed to help people. And it just goes to show how much the insurance companies don't care about what's actually happening with their patients. They just want to make sure they're making as much money as possible. Of course, they want to deny this MRI because that's too costly, but they can make more money if the patient's put on some medications. Granted, we'll get the patient back and see if he's willing to try some non-steroidal anti-inflammatories and some Tylenol, maybe some muscle relaxers. You know, he may have the right to say, I tried them for a week and I didn't like them. At least I can document that and put that down, or I'm going to very, very much make sure that I document that the reasons why he doesn't want to take it. And we're going to document all these risk factors using the data to backlash against what the insurance companies are deciding. And, we'll see. We'll see what happens. I'm sure I'll be able to get this approved based off of, trying to jump through the hoops. But this is a clear example of where we're losing in healthcare and why I believe the insurance model is going to have to change, or it's going to be broken in the future, where more and more patients are willing to spend out-of-pocket money to get the tests and procedures done that they want to get done without relying on insurance. And this is just one small example. We have to go through peers to peers, and we have to go through denials all the time and appeals. And, it happens in practices all across America, hundreds of times a month on different things. It can be medications, it can be imaging, it can be treatments, procedures, surgeries, what have you. But it's unfair that we continue to rely on the insurance companies to dictate how we operate and how we care for our patients. And I think the tide is changing. I think we're on to what these insurance companies are doing. And I think that we, as collective physicians in the private practice world or alternative ways to get patient care, we're looking for ways to help our patients without the dictation from the insurance companies. Well, anyways, I hope you guys found this useful and insightful, and maybe you're as frustrated and angry at the system as I am. It's time to have some dialogues and have some conversations. I'm happy to discuss more on these topics. Feel free to drop me a comment below, hit the smash the like button, follow us, subscribe, and follow us on the other social media platforms. And looking forward to talking to you soon. Take care. Bye.